Good evening. My name is Jim Seidlecki, Deputy County Manager in Adams County, and I will serve as your host for this evening's call. We want to thank you for joining us for this COVID-19 telephone town hall. This event brings together Tri-County Health Department with the counties it serves, Adams, Arapahoe, and Douglas, which together have more than 1.5 million residents. We appreciate you joining us for this very important update on COVID-19, the coronavirus. We have a lot of folks who will be joining us tonight, so while we are waiting for some calls to go out, I'd like to let everyone know that you can ask a question by pressing *3 on your phone. Again, *3 on your phone, and one of our friendly operators will help take your call. Tonight, we hope to bring you an update about the state of the pandemic within our communities. We want to share some best practices and important information you can use to protect yourself and others. And we also want to update you on what your government officials are doing to manage this situation. We would like to let everyone know that we are practicing what we preach tonight, and that means that our panel of experts is scattered in locations across 3 counties. It's important that you know we're practicing social distancing as we instruct others to do so. We will try to make this as seamless as possible, but with everyone in different locations, you might hear a little bit of silence on occasion. Joining us tonight are members of the Tri-County Health Department, as well as elected officials, sheriffs, and emergency responders from each county. Now, you have questions. In fact, we already have many lined up, and we'll get to as many as we can during this call. A reminder, if you're just joining us, if you want to ask a question, you can press *3 on your phone or send a question through the website if you're streaming this event live on arapahoegov.com/townhall. First, we'd like to start with an update from Tri-County Health Department, and joining us is Dr. John Douglas, Executive Director, who has been doing an amazing job with response to the outbreak and answering a lot of questions. Welcome, Dr. Douglas.
Yeah, thanks a lot, Jim. Terrific to be with you and such a great panel of my peers who are fantastic partners in helping us deal with this epidemic. I really also appreciate those who've called in. As you've been hearing over and over again from the governor, the president, et cetera, this is an all hands on deck, everybody working together kind of situation. And the information that you gather, the misinformation you may be able to dispel, and how you work with your community in this is really vital. Jim, I'll give maybe a 1-minute update, and hopefully that will sort of set the stage for us. So we are in the middle of widespread community transmission in Colorado. This is happening in most states in the U.S. Colorado is about maybe 7th or 8th now ranked in terms of number of cases diagnosed. We think this is a point where the epidemic is increasing fairly dramatically. We say we think because we have insufficient testing right now to help us capture the true scope of it, but everything we know about it tells us that we are expanding. What we're trying to do at this point is really refine our strategies. As you're probably aware, one of our most important strategies is social distancing, which is a fancy way of saying we need to stay apart from each other. And there have been various measures that have been promulgated. The governor has closed schools. The governor has said social gatherings bigger than 10 people or in public gatherings shouldn't happen. The governor has said that businesses that are, quote, non-essential shouldn't have more than 50% of the workforce on the floor. He has also said bars, restaurants, casinos, other venues like that ought to be closed. Denver yesterday implemented a stay-at-home order. Tri-County, in collaboration with other metro counties, is, even as we speak, considering how we might implement such an order that would be consistent with Denver, consistent with the other counties. The basic premise is let's stay at home as much as possible. Let's only go out for essential needs, and let's be really attentive to trying to hunker down so that we can begin to reduce transmission and protect our healthcare system from becoming overwhelmed. And we're not saying that because we want to take care of, we don't want the doctors and nurses to be busy. We're saying that because we don't want them to run out of beds to put us in if we get sick. or ICUs to take care of us if we get sick. So the epidemic's increasing. We think this social distancing maneuver can be very effective. The community is a critical part of it, and your cooperation, endorsement, and really helping us sell the norms that right now staying as sequestered away from other people as possible, getting outside but doing so with safe social distancing is a critical part of how we're going to make our way out of this problem.
Thank you, Dr. Douglas. We'll begin answering some questions in just a moment. First, though, we'd like to remind everyone that even though county buildings are closed, there are still ways to conduct business with each county. The best way to find out how to do that is by visiting each of our websites. We've included the links on the image on your computer if you're streaming or on Facebook. Each of our websites also has important information about COVID-19 and resources you can use to keep yourself and your family safe. If you'd like to ask a question, once again, press *3 on your phone. Let's get to our first question. This is for Michelle Ashkenazi from Emergency Management Perspective, and the question came in online. How are the hospitals preparing for what seems to be a likely extreme influx of cases? Are there enough masks and protective gear available?
Thanks so much, Jim. That's a great question. So it's important for everyone to know that our hospitals maintain surge plans on an ongoing basis. And as part of that planning within the metropolitan area here, it involves the activation of a regional coordination group, and hospitals work together on tracking capabilities, capacity, and resource support. And this group is continuing to work together to most effectively address surge that may come from this type of a response. They're also working closely with public health on appropriate guidance, resource prioritization, and updating all of us on capabilities so that we can begin in advance to address any of those anticipated challenges. Additionally, for the second part of that question, our hospitals maintain a supply of personal protective equipment for this type of response. So that includes masks and other things. And so we know that these supplies are certainly not endless, and we're working on ways to coordinate on optimizing the use of the recommended personal protective equipment, and then to make sure that that guidance is being released so that we can continue to do our best effort with that. We're also continuously monitoring the supply of masks, and our hospitals at this point are still receiving their resupply as per their usual processes. And in addition, using the state resource mobilization process to request and try to acquire additional supplies. So while they may not be receiving everything they're requesting, they are being prioritized for resources as we receive them in our state.
Thank you, Michelle. And for the benefit of our audience, you'll likely hear Michelle's voice again tonight. She is the Director of Emergency Preparedness, Response, and Communicable Disease Surveillance for Tri-County Health. Let's get to our first phone question of the night, and it is Kristen. Kristen, go ahead.
Hi, can you guys hear me?
Yes.
Excellent. So my question is about shelter in place, which several counties and most recently Denver County put in place yesterday. I am wondering if the Tri-County Health Department and our commissioners in Adams, Arapahoe, and Douglas counties will be instituting the same. I'm seeing a lot of bad behavior here in Douglas County where I live, where people have actually said out loud, well, Governor Polis didn't issue a shelter in place, so yeah, let's get together for margaritas tomorrow night. I am not even kidding about that.
Okay, thank you, Kristen. I believe that question is best directed to Dr. John Douglas. Go ahead, Dr. Douglas.
Kristen, thanks, and thanks for the report from the field, as disappointing as it is. Tri-County does believe more social distancing is needed. We believe that the shelter-in-place order issued by Denver yesterday is really a critical step. We have been working over the last 24 hours with our elected officials, our Board of Health, and with other counties in the metro area to craft very similar orders. We're in the process of finalizing those this evening. I expect that we'll be able to release them sometime tomorrow, I hope tomorrow morning. Potentially, in fact, I hope being able to go into effect Thursday. Still got to let the ink dry, so not a completely done deal, but getting very close. And if you've seen Denver's orders, or heard about them on the radio, ours or TV, ours are 99% about the same. We really think that syncing up and doing things together is the most effective way that we can work as a community. And we frankly think the notion of an order, which says you got to do this or you're breaking the law, is a stronger message than, we'd really appreciate it if you wouldn't get together and have margaritas. So I hope we are able to achieve more of the distancing I mentioned earlier. So thanks for that question.
Thank you, Dr. Douglas. Now's a good time to remind everyone about the census. This past week, invitations for the census arrived in your mailbox, hopefully. There are a few ways you can complete the census, and two are absolutely critical right now. New this year is the ability to take the census questionnaire online using your computer, tablet, or smartphone. I did that a couple days ago. It takes about 5 minutes. You can also call. If the Census Bureau doesn't receive your response online, you will be mailed a paper questionnaire in a few weeks. It's very important for us to count each and every member of our communities to help fund important services like libraries, transportation projects, health programs, and more. It's quick, it's easy, takes less than 10 minutes for the most part, and it is safe. So let's get to another question, and this question comes from our online audience, and it is directed towards law enforcement. We have Arapahoe County Sheriff Tyler Brown with us to answer this online question. It reads, I've heard cyber scams about the coronavirus are starting to go viral. How can we protect ourselves?
Well, that's a very good question, and we are dealing with this on a daily basis. We've seen an influx in the registration of web addresses that incorporate COVID-19. The best practice that we can recommend is that you get your information directly from the county website, Tri-County Health's website, or the CDC. It's important that you rely on those specific websites to get the correct information, as well as not fall victims to scams. So be very careful when clicking on links in emails and on social media. So that's how we're trying to combat that. So just be very cautious when you're looking at this and only rely on those specific dedicated websites that have already been created. So.
Great. Thank you so much, Sheriff Tyler Brown from Arapahoe County. Now let's take a question from a caller. This is Ann calling in. Ann, go ahead with your question.
Hi, my question is pretty much a follow-up to Kristen's question. In our area, I live in Adams, and I'm seeing a lot of children, teenagers, and everything still going to the parks, the schools, the playgrounds, and I'm wondering when someone's going to actually put a stop to that. I'm amazed at the amount of teenagers and young kids that are out gathering in groups. I realize that they're neighborhood kids, but they're still getting together, going out places, and the parents are allowing this. I don't know if parents are at work, and I'm just wondering when, even the schoolyards or the little neighborhood playgrounds and parks, when someone's going to actually block those off.
All right, that sounds like a question about the transmission of this, so we'll direct it towards epidemiologist Dr. Bernadette Albanese. Dr. Albanese?
Hi, good evening, everyone. Dr. Albanese here with Tri-County Health Department. Thank you for the question. I think we have, been in communications with the Parks and Recs department about these kinds of issues. I think, at this juncture, I can't speak for every Parks and Rec group in all the municipalities for each of the counties about their decision-making to close these areas. I appreciate your comment about trying to message parents and families, including for children and school-age children and young children, about the need for social distancing and about the need for keeping that separation. I think it's one thing if a family wants to go to the park amongst themselves and throw a football or kick a soccer ball just among themselves to get that great physical exercise and get some fresh air. But I agree with you about trying to share that message to everyone listening in and beyond about really heeding the advice about staying away from other people. But we can send that concern on through to our Parks and Rec folks and see what else they'll take under consideration. Thank you.
Thank you, Dr. Albanese. We hope everyone is finding this information valuable and useful. If you are interested in being put on a list for future telephone town halls, you can do that right now by pressing 1 on your telephone, and your number will automatically be added to our list for future telephone town halls. We're going to go to our next question now, coming in over the phone. Ashley, you're next. Go ahead with your question.
Hi, I'm wondering, as far as resources go for those of us who are finding ourselves unemployed, other than what's nationwide, what's locally when we can't get through to the resources that are there because the phones are busy and whatnot, what can we do?
We're going to direct your question in just a moment, but we did receive new information today that the state is going to have these things in place by last name. We're fortunate to have J.J. Ament with us from Metro Denver Economic Development. J.J., would you like to address this question?
Ashley, I'm sorry about your circumstance, and I understand how frustrating it can be to try to reach the Colorado Department of Labor and Employment when so many other of our fellow citizens are also trying to reach them for the same unfortunate reasons. Please try to do that. Continue. If you can access by the internet, it's colorado.gov/CDLE for Colorado Department of Labor and Employment. As Jim mentioned, they're putting procedures in place as we speak to be able to accommodate more callers and more inquiries on an organized basis. So check by your last name. Those instructions will be available to you on the website. And then additionally, I would encourage you or anyone who's facing some financial hardship because of the unexpected loss of their job due to COVID-19 to call your lenders and the people that you do business with, whether it's your landlord, your mortgage company, your credit card company. Affirmatively reach out to them, let them know you've been impacted by COVID-19. Again, your credit card company, your bank, your mortgage lender, even your landlord for rental assistance, reach out to them directly. Each one of them are putting together programs that are unique to their own businesses that will be available to you to provide some relief while we're waiting on Washington to come with the complete package.
Great advice. Thank you, JJ. We also have some human services directors on the phone, and I'd like to get the perspective from Douglas County. If our human services director from Douglas County could chime in on this, that would be beneficial.
Good evening, and thank you for the question. This is Dan McKelkey, the Director of Human Services for Douglas County. I would also encourage you to go to your local county department's webpage and also research what benefits and assistance could be offered there. I believe there's a link on all of the county's web pages, but you could also Google whatever county you live in, the Human Services Department, and you will have links to applications for a myriad of services.
Great advice. Thank you so much. We're going to go back to the phones now, and Kathy has been waiting. Kathy, go ahead with your question.
Hello. Thank you for allowing me to ask. I am very interested in knowing statewide if we have more testing going on, because we've got so many people walking around and they aren't 6 feet apart. So if people are infected and they don't know it, then the whole population is at risk.
Thank you, Kathy, for that question. And since it's directly correlated to transmission, we're going to go back to Dr. Bernadette Albanese. Dr. Albanese?
Is yes, it is increasing. The biggest surge in availability of testing, meaning that tests are being done, is coming in the setting of our hospital laboratories and our what we call our commercial laboratories. So some of the commercial laboratories, so if you go to the doctor's office and they do a blood count on you or check your electrolytes, often those are sent to a commercial laboratory, LabCorp, maybe a recognizable name, Quest is another one. And so those big national commercial laboratories have been offering and I think trying to expand their testing for at least a couple of weeks now. In addition, several of the larger hospitals, particularly in the Denver metro area, but they also potentially provide services to some of the smaller hospitals in other counties, are now standing up tests that they can do within their own laboratories in-house within the hospital that have received approval from the FDA, and so that's allowing more testing to be done. So a lot of that is going to be impacting some of the priority groups for testing because it isn't, universally available. So a big focus on testing hospitalized patients so that there could be careful decision making about how to manage those patients. Patients being tested who have what we call our high risk group for having more difficulty controlling the infection. So our seniors, people with weak immune systems, people with chronic health conditions, also priority for testing. Testing for seniors who may be living in settings like long-term care facilities is another priority. So that is where a lot of the testing is being done. So we're obviously seeing test results come back because we're seeing our case counts go up pretty sharply, not only in our 3 counties, but also around the state as a total. But you do bring up a very important point that I want to make. At this juncture, it is not likely that anyone with symptoms of COVID infection are going to get tested, okay? So what I am asking the public and everyone listening is to realize that you cannot rely on a test result to make decisions about your behavior when you are not feeling well. Do not expect to use the test result to say, now I can go outside because my result is negative, or now I should stay inside because my result is positive. We have enough disease going on in our 3 counties and around the state to say that a lot of people who have this early symptoms of COVID, which could be fever or cough or shortness of breath or sore throat, that the beginning of that illness may very well be due to COVID-19. You should heed advice from your doctor and from public health officials that if you have those symptoms, you need to stay home. You need to stay away from people. Do not expect that a test result is going to change that recommendation because it's going to be people with milder symptoms who are going to make up the bulk of who has infection and disease in our state are not going to be able to be tested across the board. Certainly not at this juncture. And this is a critical juncture for people to be heeding the advice to stay home when you have symptoms. Those symptoms may remain mild with COVID infection. Those symptoms may get worse over the course of several days. And so when we are talking to people who have tested positive and we are asking them how their symptoms started, it's not uncommon for us to hear about symptoms that started out mild and maybe stayed mild. And yes, a lot of those people are not heeding advice and not staying home. We need that to change, regardless of getting a test. We need people to change their behavior now and stay home when you're sick. Thanks very much for your question.
That's the guidance from Dr. Bernadette Albanese with decades of experience studying infectious disease. We want to thank you for that guidance. Good advice there. We have a lot more questions to get to, but we heard earlier about where we can find good information about COVID-19, and there are 2 websites that we'd recommend. The first is that of our own Tri-County Health Department. You can find them online at tchd.org. The second is from the state of Colorado, and you can access that website at covid19.colorado.gov. We have another caller from Centennial. Karen is on the line. Karen, go ahead with your question.
Hello. First of all, thank you for all your work and the time and efforts you're putting into this. My question is, I want to support our local businesses and the restaurants in that, but my concern is how safe is it taking the takeout foods? I have worked in food service in the past, and workers were not always that thorough on even following washing the hands, which was drummed into a since the first day of hire. And is it better to get hot foods rather than cold foods so you can reheat it? Or what is the safety measures we should take if we do take out foods?
Good question, Karen. We'll have Dr. John Douglas answer that. Dr. Douglas, go ahead.
Yeah, thanks, Karen. Really good question. First of all, thank you for even thinking about it, because supporting our local businesses through these takeout measures, I think, is critically important. And the more all of us can do that, I think we're helping ourselves and helping our businesses. Let me say that all commercial food establishments in Colorado, and certainly in the Tri-County area, are regularly inspected by public health staff. That's what we spend about 10% of our staff works in that capacity one way or another. We periodically do find things that are not correct, although they get corrected quickly. And while we pay attention to the issue of foodborne illness, we don't think that's a particular issue at this point in time. I think, therefore, as long as you are going to a licensed establishment, your risk is probably no greater if it's hot or cold. I think it's really what's up to you that would taste good.
Dr. Douglas, we all know that changes nightly, so thank you so much for the advice there. We want to go to some of the online questions that we're getting as well. Jasmine has written in, and her question reads, I own a mobile home. Am I able to get lot rent assistance? And we have Cheryl Turnus from Arapahoe County here to answer that question. Cheryl?
Yes, hi, thank you. I would recommend going to colorado.gov/peak, which is the online assistance program for Colorado Department of Human Services, and there are a multitude of programs that you might be eligible for. And depending on which county you live in, there's also a general assistance program, and you can contact that county directly. So in Arapahoe County, you could simply look us up on our website, give us a call, and we would direct you on how to apply for our general assistance program.
Cheryl, thank you, and we'll remind everyone, if folks are just jumping in, J.J. Ament from Metro Denver EDC also had some great advice, and that is to make an effort to contact all of those folks who may be impacted by your inability to pay. If you have maybe been diagnosed or have been impacted by COVID-19, call your credit card companies, call your mortgage companies, and of course, get your local government involved to see what efforts we have and what opportunities we have to help. We're going to go to another phone question now, and this is Maria. Maria, go ahead, you're on. Marcia, I apologize. We have handwriting issues. There's a lot of doctors in the room. You folks can understand that, right? So, Marcia, I apologize. Go ahead.
Hi. We are in our 70s, and our question is whether you have any special advice for our end of the age spectrum.
Dr. Douglas, this seems like a nice general question and a good opportunity to address the senior community.
Yeah, Marcia, thank you. You're one of our most important residents right now in terms of us wanting to protect you. So as you're undoubtedly aware, folks, even in their 60s, but certainly over the age of 70 and then even more so 80, are at greater risk, not of getting infected, but of getting sick if you do get infected. And so advice for you is really make social contact. For example, I don't know if you have grandkids. I do. And I'm sure if you do, you like interacting with them or other friends, other people's grandkids. This is the time to interact with them over the phone or Facebook or Skype. The more you can limit your contact really with almost anyone else for the time being, the better. Now, you can be outdoors, and as long as you are maintaining social distancing, and we mean 6 feet by that, getting exercise, taking walks, enjoying the increasingly nice spring weather is really important. When you go out for essential items, food, drugs, materials for personal cleanliness and whatnot, many stores are now, as you may know, setting aside special hours for older people and folks with underlying diseases. Those are often early in the morning. The governor just put out a plea to some of our big markets today to try to ramp that up. Be attentive to that and try to take advantage of that if you can. I think our grocery store workers are almost like ER workers right now in terms of the heroic work they're doing for us. But be aware that whatever you pick up off the shelf could have been picked up by somebody else who might not have been practicing good hygiene. So wash it when you get home before you put it in the fridge or the pantry or you prepare it. If you get sick, as Dr. Albanese said, and again, the symptoms of COVID are fever, cough, and shortness of breath, although even a mild cold right now could be that. Stay home. If you start to get worse, call your doctor. Not so much because you need a COVID test, as Bernadette said, that's not really available for most people, but to really help you understand Are there other tests you need? Could you have the flu? Or are you starting to get serious enough that you need to be seen by your doctor or potentially even in an emergency room? So be careful, maintain your health. You certainly can protect it if you take those precautions, I think.
Thank you, Dr. Douglas. We'd like to ask a general question for Human Services. We'll direct this to Katie Griego, the Director of Human Services for Adams County. Katie, the question online reads, how are you handling most government operations with assistance programs for the public? So with most government buildings now closed, what is your modified operational approach for these assistance programs in Adams County? And again, that question is for Katie Griego, the Director of Human Services in Adams County.
Hi, Jim. Thank you. So the department is processing public applications and rate determinations remotely, similarly to how you've heard the other departments of human services and communities taking their approach. So we also encourage you to go to coloradopeak.org. We continue to mail out EBT cards. That's the card that helps you access your benefits in grocery stores. And if you have questions, continue to give us a call because we're here to take your questions and work with you.
Great, Katie. Thank you so much. We're going to go back to the phones and take the next question. Jane has a question. Go ahead, Jane.
Thank you. I represent senior housing, and many of us are also experiencing a shortage in personal protective equipment, or PPE. We are finding that counties across the country have additional PPE to provide to senior housing. Is that true for the Tri-County area?
We have one of our emergency management directors in the room, Nate Fogg from Arapahoe County, is happy to answer that. Nate, go ahead.
Sure. Great question, Jane. And I think the short answer is yes. The long answer is yes, and it's not enough. We are, across the three counties, taking creative measures. We've done some buyback programs from construction workers and auto body shops and asbestos abatement companies. We've engaged in volunteer donation drives, and as of today, at least in Arapahoe County, I can say we've pushed out over 6,000 pieces of PPE, primarily masks, and most of that number has gone to our senior and assisted living facilities.
Thanks, Nate. We really appreciate it. More questions. If you have one, hit *3 on your phone right now, and one of our operators will guide you through the process so you can get into the queue. We have more than 45,000 people on the call right now, and we're going to get to the next question so we can get to as many as possible. Barb is up next. Barb, go ahead. Barb, are you on the line? Oh, we understand sometimes folks hit the
No,
mute
I'm
button.
here. I'm here.
All right,
I'm
go
here.
ahead.
Can you
Go
hear me?
ahead, Barb. Yeah, we got you.
Thank you for keeping us up to date. Is there any data yet if a person gets COVID, if they can get reinfected? And can you have COVID and not have a fever?
Those are two good questions for Dr. John Douglas. Dr. Douglas, feel free to weigh in.
Yeah, sure. I think it was, can you get reinfected and can you have COVID without a fever? The answer to the second one is not usually, but you can. So the absence of a fever, we use fever actually as a fairly helpful indicator of COVID, but it's not absolute. So for example, there's some entities that are doing temperature screening to determine if someone going into a business or whatnot may have a fever. That's a pretty good way to screen. It's not perfect. If you have a cold, it's probably a cold, but it could be COVID. So good sign, but not absolute. The second question about reinfection is at the top of like everybody's mind right now, because globally we've had, over 300,000 people infected. Many have died, but most haven't. And so what's the story with those who recover? Are they immune or not? Early studies suggested that maybe people did get reinfected, but it looks like now maybe that was not really good testing to know they were already better, and then they got retested and they were positive. that was probably the same infection. So lots of interest in that, especially as more people get infected and recover. I think once it becomes determined that there is some immunity, then the question is going to be, how long does it last? We know, for example, that flu vaccines, or even having the flu, doesn't protect us all that long. And so I think that we would have to be attentive to trends in how the epidemic progresses to know that once we're infected and better and presumably immune, if that's going to be pretty good for a while, or maybe only for a shorter while, 6 to 12 months or so.
Thank you, Dr. Douglas. We have a lot of calls coming in. We're excited about the participation, and we're grateful for all of you waiting patiently in the queue. Our next caller is Susan. Go ahead, Susan, with your question.
Hi there. Thank you very much. I would like to know if there's any definite, which I'm sure there's not, but is there anything that tells you what the lifespan of the virus is on surfaces for transmission? I have heard a range from hours to days. Is there any new updates on more definite?
A great question for an epidemiologist. Thankfully, we have one on the line. Dr. Albanese, go ahead.
Hi, thanks, Karen, thanks for your question. So the strict answer is no. The scientific data has not accumulated enough to say how long the COVID virus remains on surfaces and can still be viable, meaning alive, to cause infection. So the verdict is not done on that. That being said, for sure, most COVID disease is likely being spread from person to person when a sick person coughs or sneezes, releases droplets from their nose and mouth into the environment immediately around them, and someone who is close to them can either have that virus from the cough, from those droplets from the cough and sneeze, land on their face or eyes or nose or mouth, or somehow be breathed in a short distance. That's why we're using that 6-foot radius for social distancing, because that's a comfortable distance away when you're outside 6 feet from someone else, a comfortable distance that those droplets will not reach you. Now, again, a person who is sick and infectious and coughing or sneezing could also potentially contaminate their hands by coughing or sneezing into their hands and then not washing their hands immediately. And then if you were to shake that person's hand right away, then you might get virus on your hand. And then if you didn't wash your hands and then touched your eyes, nose, or mouth, that might be another way for the virus to inoculate in your body. So we still think that that is the primary way this disease is spreading. And because of that, why we are strongly advising and advocating this concept of social distancing, staying home when you're sick. Now, that being said, there are things that you can do around your environment in your home and the environment in your workplace, for example, to keep those areas cleaned and disinfected. Okay, most household disinfectants will work well against the COVID virus. So get into the habit when you come, if you're still working off-site, when you come into work, get those over-the-counter products and wipe down your doorknobs and your desktop and your keyboard and your phone in your home. Make it routine with your family. You can even make this a fun event. Make it routine in your family to be cleaning those commonly touched surfaces on your tables and your kitchen countertops and your play areas and your doorknobs and your phones and your TV remotes. Make that routine each day that those are clean with those household disinfectants to try to just take that extra precaution in case that virus does stick around a little bit.
Thank you so much, Dr. Albanese. And any tips you have for teenagers to have fun cleaning, you just can email me those offline. Thanks so much. All right, on to our next question. And this is one that I've heard quite a bit about, and we're going to go to the phone to Mary Ann. Go ahead, Mary Ann.
Yes, hi. Thank you so much. I'm a business owner, and I wanted to know I'm actually a business owner in Douglas County and Jefferson County. And my employees that are coming to work, I wanted to know how do we need to give them something like an essential service letter or anything if they get pulled over, if we go into lockdown? Thank you.
We have Sheriff Tyler Brown here. What is the advice and guidance you're giving to your deputies?
Mary Ann, that's a great question. I've heard a lot about this as well. We are not setting up checkpoints. What we're really hoping here is that we have some social peer pressure and that people that are not essential are staying home and that only the essential people are out on the roadway. One of the things that we are concentrating on is limiting traffic stops. Again, this is going to be a social peer pressure thing. I'm asking citizens to drive safely. Look out for your neighbors. Look out for the people that are on the road because most likely they are essential employees in some type of industry that are providing services to try to combat COVID-19. So again, we are not having checkpoints. We are not stopping people randomly. And we're asking for that social peer pressure to kick in and people that are not essential stay home and allow essential employees to get to their jobs. Thank you.
Good advice all the time, especially right now. Thank you so much, Sheriff. We've got an economic question here, and I know this has been on a lot of people's minds as well. What kind of effect will this crisis have on the economy in Colorado, especially along the Front Range? Again, we have J.J. Ament, the CEO of Metro Denver Chamber of Commerce, here to answer that. J.J., go ahead.
Well, thanks for the question. In the short run, the impact is going to be significant, and we're going to see alarming, probably the largest spike in unemployment claims in Colorado's history. But it is very important to remember that the economy is a long game, and with short-term uncertainty and the volatility is certainly unnerving, and there are going to be many people in our community who will need our help. Remember, Colorado is resilient. Our underlying financial systems are sound. Our supply chains are not broken. We still maintain a diverse set of industry clusters. We had the number one economy for 3 years running coming into this crisis. And just in January, February, we were named the third best job market in all of America. So despite these alarming times and the need to take precautions and listen to our elected leaders and our health department officials and try to avoid too much of the internet, social media, and Twitter feeds, our economic future, we believe, will be very bright. And when this public health emergency is behind us, there's no reason to believe that the Metro Denver and Front Range economy won't rebound stronger than it was before.
And a lot faster than maybe some others, too. Thank you so much, J.J. Ament. We have a lot of folks in the queue. Tens of thousands of you are listening, streaming this meeting on live, either Facebook or arapahoegov.com, and listening at home. We thank you so much for joining us. Odella, you have a question. Please go ahead.
Hi, and hello. Thank you so much for having this meeting for several of us to listen in and get answers to abundance of questions. Some of them of mine are answered through the answers of others, but a couple of the main questions that I had were, how should we handle maintaining our family health, a household of 4, when there's 2 members that go out to work? And what should I do or we do when those come home to maintain the health of those that don't go out? And also I was wondering, in addition to that question, a person that has shown early symptoms that didn't last very long and went away, could they come back more severe? And is there a test that is in development that will let us know if we will be immune to the virus at a later date if we had early symptoms?
Dr. Douglas, go ahead and take a stab at that one.
Sure. 2 questions, really good questions, Adela. Thank you. So family health, vital to be thinking the way you're thinking. 2 people go out to work. How do you protect those at home? You got to be careful. Those that go out to work want to try to do social distancing. And again, very soon, those that go out to work are going to be those that are going out to the essential work that we think needs to be maintained. They need to be socially distancing themselves in their workplace if they can. I mean, if one of the sheriff's deputies pulls somebody over, they've got to talk to the driver, but he's already said they want to limit that. They need to avoid those folks who are at work who appear to be sick, which should be nobody now, because nobody ought to be going to work when they're sick, but it could happen. Likewise, if they're taking transportation that involves contact with others. Number one. Number two, frequent hand washing. Frequent hand washing. As Dr. Albanese said, this is transmitted by respiratory droplets. That's mostly stuff coming out of our mouth and nose and falling in about 6 feet. But if it falls on our hands and we touch our hands to our face, that can transmit it. So if you're out to work, don't shake hands. Don't give people hugs. Give them smiles. Give them friendly waves, but restrain yourself from physical contact with them. When you come home, practice those same precautions. Hand washing. Really try to distance yourself from your loved ones, your roommates, or whatever that are still at home, and they should do the same thing. They should be doing frequent hand washing, and they should be distancing themselves from you. Test regarding immunity. Kind of related to that earlier question, we're hopeful. We're not there. Generally, immunity to a viral infection or post a vaccine for a viral infection is measured by an antibody test that measures whether your immune system has created a response to the infection. There are antibody tests beginning to be marketed and used. We honestly don't know whether they're going to tell us about protective immunity or not. It's a very important topic for us to keep our eyes on. But as Dr. Albanese said earlier about immunity in general, or about some of the other questions about environmental survival, I guess in general, we're not quite there yet in terms of understanding how those tests can be used.
Thank you, Dr. Douglas. A lot more calls coming in. Press *3 on your phone if you would like to get into the queue to ask your question. We have about 15 minutes left in the call, so we'd like to get to as many as possible. Our next caller with a question is Randy. Randy, go ahead with your question.
Yes, thank you very much. I really appreciate this kind of exchange because it's helpful in so many ways. And my wife and I are seniors, and we are trying our best to conduct ourselves in a way that we don't get this virus. But I have some questions that go along with what's going to happen with our economy, and there's just two questions really. One is, I haven't heard anything about allowing people to access their 401k plans without tax or penalty consequences, and it seems like a common sense way to help people get through this disaster. But the more important one is what's going to happen to our small and medium-sized medical providers that are now either closed or sized down for who knows how long. And again, now are insurance companies being asked to help these businesses with loans or grants or to make sure that these services will be up and running quickly again, because we do lack some of these medical services now. A
lot of questions there, and J.J. Ment's going to try and tackle a few of them. We appreciate it. Go ahead, J.J.
So thank you. To your 401k question, Empower Retirement, which is the second largest 401k company in America, is also based right here in Colorado. And they have been working with the federal government on that very idea of, is there relief that can be provided to folks who could access retirement funds in a way that isn't penalized as would happen under normal times. So that's in the works, but that's federal tax policy primarily. To small and medium medical providers, and I would add dentist's office as well, commercial lenders throughout Denver, all of our commercial banks are working with the liquidity that they've been provided by the Federal Reserve, changes in rules and some liberalization of policy that's allowed banks to work with those folks specifically, both on the commercial lending as it relates to the business and also the assets and equipment that has been financed through loans, doctor or dentist office that might be more needed at the hospital right now. But the financial relief for those small businesses is something that's on the top of everyone's mind and is being provided for by each of their individual lenders.
Thank you so much, JJ. We have another call. This one is from Cindy. Cindy, go ahead.
Hi. I was wondering if it is decided that Commerce City does have to go to the shelter in place. By shelter in place, that does not mean inside your home. You're allowed to go out into your yard, correct?
Dr. Douglas, why don't you go ahead and take that one?
Yeah, so that's a great question because folks understanding this new strange thing that hopefully won't go on that long is really important. I actually don't like the term shelter in place because it's sort of like after a hurricane or an active shooter. This is really stay at home. And no, you don't have to stay at home completely. You can go out for essential services, which are going to be defined to include things like food, takeout in restaurants, pharmaceuticals, products for cleanliness, keeping your house clean, keeping yourself clean, hardwares, a variety of things like that. Social distance when you go out. So we want people to be protectively out and about, but we heard some comments earlier about, large groups of people kind of blowing off the guidance. That's the kind of thing we're trying to avoid, trying to send a serious message. Stay at home as much as possible. You're not a prisoner. You can get out for essential services. You can get out for exercise.
Thank you so much, Dr. Douglas. Let's go back to the phone, and Carl is waiting. Thank you for your patience, Carl. Go ahead with your question. Yes, Carl, we can hear you. Go ahead.
Yeah, I was wondering, I'm a patient here at St. Anthony's Hospital, and I'm getting ready to go home, and I'm wondering if these, Adams County, I live in Adams County, and are they going to be open for me when I go home? Are these services? And also, I have family that never received their food stamps or anything. We're low-income families. We need help.
Okay, Carl, thank you so much. We fortunately have Katie Griego, who is the Human Services Director in Adams County, on the phone. She can help you walk through the process briefly here on how you can apply for and even receive food stamps and other benefits. Katie, go ahead.
Thanks, Jim. Thanks, Carl. So our county is still processing public assistance applications